heart racing, chest pain, shortness of breath, and fears of dying or losing control. Is it a heart problem or panic attack? Let's break it down. A panic attack is a sudden episode of intense fear that leads to severe physical reactions, even when there is no real danger or apparent cause, typically peaking within about 10 minutes. The most common physical symptom accompanying panic attacks is palpitations. Panic attacks can be elicited by innocuous objects or situations. They are then diagnosed as acute attacks in the context of specific phobias or agoraphobia. Agoraphobia involves fearing and avoiding places or situations that might cause panic and feelings of being trapped, helpless, or embarrassed. When assessing a patient for a potential anxiety disorder, it's crucial to rule out medical conditions with similar symptoms. Panic attacks may also appear, out of the blue, unexpectedly for the individual without any explicit perceivable situational trigger. If at least one of such recurrent unexpected panic attacks has been followed by 1 month of persistent concern or worry about having additional attacks or about their consequences or significant maladaptive changes in behavior because of the attacks, the criteria for a diagnosis of panic disorder are met. When individuals report panic attacks that are not associated with such concerns or changes in behavior, such attacks are called isolated or non-clinical panic attacks. Clinical studies also revealed that first panic attacks of panic disorder patients with comorbid agoraphobia systematically differed from those first attacks reported by patients without comorbid agoraphobia. The presence of agoraphobia was associated with a more frequent occurrence of the first attack in public as opposed to in a home setting. When evaluating a patient for a suspected anxiety disorder, it is important to exclude medical conditions with similar presentations, endocrine conditions such as hyperthyroidism, pheochromocytoma, or hyperparathyroidism, cardiopulmonary conditions such as arrhythmia or obstructive pulmonary diseases, neurologic diseases such as temporal lobe epilepsy or transient ischemic attacks. Other psychiatric disorders, other anxiety disorders, major depressive disorder, bipolar disorder, use of substances such as caffeine, albuterol, levothyroxine, or decongestants, or substance withdrawal may also present with similar symptoms and should be ruled out. Compassionate listening and education are an important foundation in the treatment of anxiety disorders. Patient education itself can help reduce anxiety, particularly in panic disorder. The establishment of a therapeutic alliance between the patient and physician is important to allay fears of interventions and to progress toward treatment. Caffeine can trigger panic disorder and other types of anxiety. Those with panic disorder may be more sensitive to caffeine than the general population. Smoking cessation leads to improved anxiety scores, with relapse leading to increased anxiety. In addition to decreased depression and anxiety, physical activity is associated with improved physical health, life satisfaction, cognitive functioning, and psychological well-being. Exercising at 60% to 90% of maximal heart rate for 20 minutes 3 times weekly has been shown to decrease anxiety. Yoga is also effective. When experiencing a panic attack, focus on deep breathing to help calm yourself. Try to breathe in slowly through your nose, hold it for a few seconds, then exhale slowly through your mouth. Grounding techniques, such as focusing on your surroundings or using your senses, can also be beneficial. Light exercise, repeating a mantra, or practicing mindfulness may help relieve symptoms. It's important to recognize that what you are experiencing is a panic attack and remind yourself it will pass. The treatment of panic attacks involves adopting a healthier lifestyle, integrating therapy sessions with a psychologist, and following a medication plan prescribed by a psychiatrist. If you're struggling with panic attacks or anxiety, it's essential to understand the symptoms and explore the right treatment options. From ruling out medical conditions to managing stress with lifestyle changes and therapy, there's always a way forward. Remember, you're not alone on this journey. If you're interested in learning more about medical topics, anxiety management, and health tips, don't forget to subscribe to my channel. Stay informed and take charge of your well-being. Hit that subscribe button now.